All right, guys, welcome back. Round three. I'm really trying to break this into four parts. Do notice that I haven't been going through these slide by slide. The slideshow is available under the cardiovascular chapter. You can go through and fill out your notes if you would like to, and I would still recommend that you do the pre-reading or at least check out your book and read those. But I'm trying to hit these main points and really want to show you these things on the diagram rather than going slide by slide. So make sure you're doing that in addition, but I want to focus on the most important things. And if there is something that I'm leaving out from the notes that you don't understand when you read or you're looking at the notes, please, when we meet and we do our Zoom or Google Hangout, please feel free to ask questions or email them, whatever you may choose. So what I want to do in round three here, I want to take a look at the inside of the heart. I want to talk about two things. I want to talk about valves, and I want to talk about the main arteries and veins, which we kind of already did, but we'll recap on that. So what we've got going on here, we talked about the four chambers of the heart, and in between those chambers, you have something called valves. They're actually called atrioventricular valves because they are in between the atria, or the atria, plural, and the ventricles. So they're going to separate that. And the point is, if you think about how the heart works, so the atria are going to contract at the same time. The top of the heart will contract, and the blood on both sides of the heart is going to be pushed down into the ventricles. After that, those are going to release the blood into the ventricles. Then the ventricles are going to contract. The atria will relax. Well, we want to make sure that when those ventricles contract, that they are pushing the blood up and out of the heart, and we don't want blood to flow back into the atria. If it does, that's called regurgitation. A small amount of regurgitation is what we know as a heart murmur, if you've ever heard of that. But to make sure that blood is flowing in one direction through the heart, so that it is effectively getting sent to the body or to the lungs. So those valves are atrioventricular valves. Once those atria have pushed the blood into the ventricles, those are going to close to make sure that then blood is going to be pushed out either the pulmonary artery, which goes to the lungs, or the aorta, which is going to go out to the rest of the body. Now, there is a difference between these. So you'll notice these little web-like structures. We call that the chordae tendineae. And over here, you've got your chordae tendineae. It's going to actually anchor that valve to the inside wall of the heart. Over here, there are actually three attachment points. So we call this AV valve. So it's an AV valve, both of them are. But this AV valve is referred to as the tricuspid valve. Over here, tri meaning three. Over here on the left side of the heart, we have two anchor points. So we call that the bicuspid, or more frequently, because we can't just have one name for everything, you'll actually hear it called the mitral valve, and you hear that a lot. So this is either your bicuspid or your mitral valve. And both of these AV valves, their job is to prevent backflow into the atria and to push blood and make sure that it goes to the main arteries outside of the heart, so the pulmonary artery and the aorta. So those are our AV valves. Now you have two other valves, and these are called the semilunar valves. And these are going to be found in between the ventricles and the arteries. So over here, we have the pulmonary semilunar valve. So once that ventricle contracts and it pushes the blood out of the heart, we don't want the blood flowing back into this right side of the heart. We want to keep making sure it's going in one direction. So over here we have this pulmonary, again, that means lungs, pulmonary semilunar valve. And then you can't really see it, but it's hidden behind here. You're going to have your aortic semilunar valve. So once this left ventricle contracts, and it's going to push that blood out of the aorta, that semilunar valve, the aortic semilunar valve, is going to make sure that that blood doesn't flow back into the heart, that it's going to stay out to the body. So those are our four valves. Again, we have our tricuspid and our bicuspid, preventing backflow into the atria. And then we have our two semilunar valves, our pulmonary semilunar valve and our aortic semilunar valve. Okay? Last thing, just to kind of recap our main arteries and veins. Remember, arteries are going away. I talked about the aorta going to the rest of the body, the pulmonary artery going to the lungs. I didn't talk so much about the veins. So remember, the veins return the blood. So once the blood is dropped off all of its oxygen, it needs to return to the heart, and it's going to do that through the vena cava. So these two tubes right here, this one going up and behind the heart, but it actually empties up here. That's the inferior vena cava. And then this is going to be bringing blood from the top half of your body. This is a superior vena cava. So the vena cava is going to bring deoxygenated blood back to your atria on your right side. Over here, once blood is gone to the lungs and it needs to return, it's going to go through the pulmonary veins. So the vena cava, remember, is a vein returning from the body, the systemic. The pulmonary veins is part of the pulmonary circuit. It's returning blood from the lungs, oxygenated blood to the left side of the body. So our four main blood vessels that we need to know out of the heart, we need to know the vena cava and the pulmonary veins. Those both bring blood back to the heart. And then we need to know the aorta and the pulmonary artery. Now, it's kind of weird to think about, but arteries typically carry oxygenated blood, because if you want to think about it, arteries are going away from the heart. Typically, arteries are going to carry oxygenated blood away from the heart into the rest of the body. The only exception to that rule is the pulmonary artery. It's the only artery in the body that's carrying deoxygenated blood, because it's going away from the heart and has to pick up oxygen from the lungs. On the flip side of that, veins in general, typically, because they are going back towards the heart, are typically carrying deoxygenated blood. The only exception to that rule, think about it, it's going to be the pulmonary veins. Pulmonary veins carry blood, oxygenated blood, that just got oxygenated from the lungs back to the heart. So your pulmonary artery and your pulmonary veins are the only exception to that rule of arteries carrying oxygenated blood and veins carrying deoxygenated blood.